Hi, everyone. I'm Victoria Dunkle, and welcome back to the latest edition of the Live Better, Feel Better podcast with AdventHealth. We're so glad you joined us today because we have someone with us who is one of our favorites. Am I allowed to say you're one of our favorites?
Yes.
Okay, this is Dr. Anna Hicks, everybody. And she actually is the administrative director for age friendly services here at AdventHealth Hendersonville and now AdventHealth Polk. It's so great to have you with us today.
Thank you, Victoria. I'm really happy to be here.
Well, we're going to talk about something that is near and dear to your heart. And in the time that I've had to be able to work with you on the age friendly initiative, I have seen that that is just not lip service. You really are passionate about caring for our older population.
That is very true. I'm a geriatrician, which
Mhm.
means I have specialized training in adults 65 and older. So not only did I do medical school, I did residency in internal medicine. Then I did a fellowship in hospice and palliative care. So that's another specialty I have. But then I went on and studied just intensely on older adults and did a whole year of where all I was doing was caring for older adults in specialized settings and learning about how much the body changes as we get older.
That's really an important aspect of our approach here at Advent Health, which is to help people feel whole. And it's not just feel whole right now, but it's feel whole for your whole health and wellness journey. And it's important to know what's going to be happening as all of us continue to grow a little older every day, right?
Absolutely.
So, what drew you to this particular area of care?
Well, when I was in college, I took a class on aging and just how the body ages and how we can do it better, and different populations around the world who are aging well. Blue zones. I'm sure a lot of people have
Of
heard about the blue
course.
zones. And, the only blue zone in America is actually an Adventist community in Loma Linda. And in that community, they really tied together this whole person care. They tied together faith and um, healthy lifestyle, and they're aging really well, and a lot of the people there are living to be 100 or older, and so that really piqued my interest into how lifestyle affects aging. And then I went on to study geriatrics in the fellowship setting, and then when my husband and I moved to Henderson County about 15 years ago, we realized the population here, well, like 1 in 3 people are 60 and older. It's a
Yes.
retirement community, and there are many older adults living here. And after we moved here, I realized, well, with the training I've had, I really have something special to give back to the community. It's important for me and my husband to feel like we're part of the community where we live, and to finding that niche and being able to work with health system that wanted to know how to best care for older adults as they get older, and make sure that we don't have gaps in care, that we're really treating older adults well and safely,
Mhm.
and making sure we're not having big gaps in the care, that we're treating them like older adults, and providing safe care for them.
That's so important. And it's something that is part of why we at Advent Health, with your help and leadership, became part of something called Age Friendly Initiative. And we use that terminology, age friendly, a lot. But let's talk about what that really is and what it means to be part of that initiative.
Okay, so age friendly really means that we are friendly as people get older. We're friendly to older adults when they're getting medical care in our health system. And it's a national movement, and it was a great platform for us to adopt because it focuses on the 4 M's: what matters, mentation, medication, and mobility. And it just makes it easy to understand. Here at Advent Health, we like it to make it easy.
Yes.
We own it, and we try to show people that we love them by giving them this whole person care. So it was a no-brainer. It was kind of like, wow, this platform exists, and we can easily jump onto this movement so that everybody who is interacting with older adults in our healthcare system can understand the 4 M's, and can teach that to their patients and provide safe care.
So the idea of taking this on, though, with the initiative is we were one of the first health systems in the country, but especially here in our state in North Carolina, to really partner with this organization that is leading this. What did it take to become part of this?
Well, it took been working on it for 6 years.
Yes.
And so back in 2019, we formed an age friendly task force with leaders from all the different departments, not just the hospital, but also the emergency department, surgery, home health, outpatient clinics. We reached out to community partners who are working in the space of aging services, and we started meeting every month and just talking about, okay, what does it look like when someone 65 or older comes in for healthcare in all these different settings? What services do we as a healthcare service not provide? Who's doing that in the community? How can we support each other in this work? And we've been meeting every month since 2019, the
Yep,
Age Friendly Task
we
Force.
have.
So that's what it took. And it looked, just very intentional, looking at what's happening, let's say within the primary care setting. Like what happens when an older adult comes in for their annual wellness visit? Are we really looking at each of the four M's? Are we starting care with what matters most to that older adult? Are we paying attention to medications and making sure they're dosed correctly for the geriatric body? Because our bodies do change as we get older. And by the time we're 65, our body metabolizes things differently. Our composition is differently. It's just as different at 65 as it is when we're babies.
Right.
And, it's important to recognize that and be intentional.
Let's talk about how this change was received by our patients because I mean, you and I've had the chance to share, and you've introduced me to several patients who've had really incredible outcomes. But what was something that the people coming to us for care notice?
Oh, they were so happy. It was like, "Thank you. Thank you for asking me what matters. Thank you for starting my care there. Thank you for listening. Um, Thank you for keeping me safe and really explaining to me why certain medications have more risks in older adults than others. Thank you for being proactive with mobility and not waiting for the fall to happen before referring into things like physical therapy or home health."
That's so important. There is such a preventive aspect or a prepping aspect of this. You know, think about things that are coming. I remember hosting webinars about how we can make our homes safer so that we can stay in them longer as we age.
Mhm.
Um, One of the things that, has been so great about this age-friendly initiative is that it's not a one and done thing. We keep listening to our patients, we keep listening to our team members, the caregivers, and hearing what they're hearing from their patients and taking it further and further. Talk about some of the steps that we have taken and places we've initiative-driven actions we've put into place.
Oh, it's been amazing. So first we started in primary care setting to make sure that we had a good baseline on our patients. And one of the first things we did was build in a memory assessment for every patient 65 and older once a year. And then we built on that to make sure we had services to help patients who might have memory impairment. Not all memory impairment's dementia. And so we wanted to make sure there was a place if we're identifying that there's an issue with memory that patient had a safe place to go where they would get a workup to really help them understand what was going on. And then we looked at the hospital setting and said, when patients come in, are we doing the 4Ms there? And we added in a delirium screening on every patient who comes in. We looked at our surgical services and we're making sure that if someone's getting anesthesia, that it is appropriate for them. We stopped using certain high risk medications very intentionally. And I can tell you, we have age friendly surgical services here. And it's been so cool to be a part of that. Our emergency department, the team there has made steps towards geriatric certification. They have been certified as a geriatric emergency department since 2020, I
Mhm.
believe. And now they're also working with the Polk team and the emergency department to work towards that as well. We went a step further and in our cancer care clinics, we wanted to make sure that we had a good geriatric workflows there so that before someone starts a treatment for cancer, that they have a good assessment of their brain health, their function, their what matters to them. And
Mhm.
in regards to that treatment, because there's a lot of things we can do to people right now, but we always want it to be within the goals of what they want for themselves. And so our cancer care clinics are age friendly recognized as well.
So let's talk about that recognition. This is a recognition that says that they're age friendly designated for committed to care. I love that it's about committing to the care we provide. And that so aligns with what Advent Health is about. But it also really just, like you said, it was hand in glove when we learned about this. This all, you mentioned all of those facets, but there's also one other step. Let's talk about what's located at our Advent Health multi specialty site at Laurel Park.
Oh, I love this. So we recognized that we really needed a specialty clinic for geriatrics. So we made it happen. And with the help of Community Foundation and other organizations who gave us grants, we turned what was half of a building that really wasn't being used into this geriatric specialty center where we have a geriatrician, we have a geriatric psychiatrist. We now have a geriatric intensive outpatient program for
Mhm.
older adults who have mood disorders that need just a little bit more than the once every 6 weeks visit. This is a program where older adults can come in and have 3 times a week counseling sessions. It's really like a boot camp to learn if you're having depression or anxiety, how to handle that, how to live with it, and how to get better. And so that was very exciting as well.
Absolutely. I remembered when we opened up the Age Friendly Center over in our Laurel Park location in Henderson County. And that really has been a beautiful place, but it's completely dedicated to caring for our older adults. But there's something added that's special because caregivers
Mhm.
need that support too. And so often caregivers put their own health and wellness to the side. But you and the age friendly team decided we needed to do something about that too.
We do. So, our age friendly task force does not just include providers and clinicians, it also includes our call center team.
Hmm.
And so, if someone calls in to make an appointment for a loved one and it's an older adult, our call center team says, "What about you, caregiver? Are you getting the care that you need?" And our geriatric psychiatry team also recognizes that caregivers can use therapy and support. And so we try to get caregivers that love and attention that they need in those sorts of visits. And that even is now extended to our hospital,
Hmm.
where our case managers are reaching out to our caregivers and making sure that they have resources available to them as well.
This is absolutely so exciting. And watching it touch lives has been just a privilege. So, first of all, thank you for what you and our incredible team members are doing. But let's talk about the latest announcement that we made recently about the fact that our friends at AdventHealth Polk are on this journey now, too. Tell me what has happened for AdventHealth Polk and what it means for that community.
Ever since they came on, we've just been working with team members down there, leadership, nurses, emergency department, pharmacy. Oh my gosh, they have a great pharmacy team.
Yeah.
And building in these 4 M's there as well: what matters, medication, mentation, and mobility. And so through that work, just recently, they've been recognized as age friendly as well, which means just safer care and intentional care for older adults. 1 in 3 people living in Polk County are 65 and older.
Another retirement community. A lot
Mhm.
of people move there or have lived there their whole lives and don't wanna leave. So I understand that that is such a priority, but it's really been amazing to see how our team at AdventHealth Polk has made it a priority to care for the older population.
And it's really interesting because not only are the older adults more satisfied with their care when we put these strategies into place, but the team members providing the care have better job satisfaction because it's the reason we get into medicine, to really provide whole person care. And the system has equipped our providers to do that through this movement. So,
That's something that's really special about AdventHealth is they do see the importance of making sure we're equipping our team to do exactly what they're called to do. Um, one of the things that is special about AdventHealth Polk is a program they had called Swing Beds and the ability to let people have some additional care in a slightly different setting than being an inpatient in a hospital. How does age friendly play into that?
well, if as you know, hospitalization days aren't as long as they used to be, and many
Hmm.
people are being told you need to be discharged from the hospital, but they're not feeling quite ready to go home yet. A lot of what matters to people, if you ask, I would say like 90% of older adults, when you ask them what matters to them, it's staying independent and being functional. And so sometimes after you've been acutely ill and in the hospital, you don't feel quite ready to go home yet, and you also don't want to move into a retirement community quite yet. So these swing beds are such a gift to that population because they can stay a short time, get a little bit more physical therapy than they could as an outpatient without having to drive back and forth. As we know, transportation is a big issue for older adults.
Mhm.
It is one of the social determinants of health with the greatest need is transportation. And so getting back and forth to appointments is not always the easiest, especially if you've just come out of the hospital with pneumonia or a hip
Right.
fracture. And so there's these beds, these unit and polk that patients can come and stay short stay and get that therapy and still have a little bit of medical oversight, but not be completely in the hospital or independent. And that is a really good fit. And so we made sure that those beds in that unit are also age friendly recognized. So we did not want just to have that for the hospital beds. We wanted those for the swing beds too.
It's so important. I had the privilege of talking with one of our swing bed patients not too long ago, and she was exactly what you said. She was wanting to be able to get back home, gain her independence, and just kind of resume her life. But she realized that what brought her to the hospital stay before had taken, it's going to take a little time to get over that. So she opted and was able to do the swing bed. And when she was able to go home, she was thrilled. But she also said how important it was for the team that cared for her. They listened, they
Mhm.
understood her, they got to know her, and she really saw the impact of the age-friendly. She didn't know we called it age-friendly, she just knew that she really loved the care she received.
And typically that may be the case. Like the patient should just know that they're being well cared for. They don't have to know the whole background or why or all the details of it. They really
Mhm.
should just feel loved and cared for. And
Absolutely.
so these are the steps we're taking.
But I know you, I've gotten to know you over the years, and, you don't stand still for very long, so what's next?
Um, okay. Well, I told you we've been working some with the anesthesia department and the surgery department so that when patients are coming in to have surgery, I can tell you that we've looked to make sure they're going to have the safest surgery possible, the safest anesthesia and the post op care. And so there's a perioperative clinic that just started in Hendersonville. Um, that patients who are coming in for surgery, if they're older and they have any risk factors, they can come in and get evaluated. And this team, the perioperative team, will follow them through their surgical time. So I'm very excited about that.
Let's tell people what perioperative means in
Okay,
case they're not you and I might know it, but
good idea. That is
yeah.
true. This just rolls right off my tongue.
I know, right? Me
It
too,
it means
guilty.
the time around surgery, so before and after surgery. So maybe somebody who's going to have their knee replaced,
Oh,
maybe they come in and they just make sure their heart is healthy enough to have that done. Sometimes they might do a little physical therapy before their surgery to build up muscles that they'll be using after the surgery that maybe they're not so accustomed to using first. Then the medications are reviewed. There's a lot of medicines, especially for pain medicines or that we get during surgical time that our body's not necessarily used to and can cause confusion and falls and constipation. And so we want to make sure that patients understand the risk factors of that and that we're using the lowest, safest doses. And so this team can help with that as well.
they're an amazing team as well. What is it about this, as you look back on what the work has been in place and the care that it has made possible and where we can go with this that really just keeps you energized about this?
Well, I think now that we've got pathways for people who are older, we're looking upstream and we're talking to younger patients now about their brain health. And so that's really our community focus for the next couple of years is helping people who are in their 20s through 50s really age well and understand that there are things that can be done to prevent memory loss, to prevent frailty, to stay active, to age better, and so we've been out in the community talking about those things and also in our primary care clinics, really focusing on brain health.
Mhm.
Because again, when you ask people what matters most to them, most of it's staying functional and staying independent.
And you've got to be able to keep your brain health in place
Yes.
to be able to do that. You say something about this when we've been on panels or I've moderated something. You and I've had the privilege to be with a lot of community groups together, and I listen to you say this, and it's really trying to break the idea that every person as they age will automatically suffer from cognitive disabilities or dementia. And I'm trying to remember the exact way you phrase it, but it's not an automatic, is it?
No, dementia is not a normal part of aging.
That's what you say. And I
Right.
love that because it empowers us.
It does. It's just the concept that as we get older, our brain health declines. It's that dementia is a disease and it does not happen to everybody. And we're just at the tip of the iceberg to understand why it does happen. But what we do know to be true is that healthy lifestyle, so the same things that keep our heart healthy, that keep our diabetes controlled, controlling our blood pressure, eating a Mediterranean diet or a mind diet, those things really do protect our brains from getting dementia later on. And I would say when we started this work 6 years ago, there was a big misconception to break that there's nothing that can be done to stop dementia from happening, but that is not true.
And I've heard you say this, and I've seen people listening and caregivers offering guidance and people realizing that it isn't a normal part of aging.
No,
I love
no.
that. You mentioned a lot of different things that we can do to protect our brain health, and we've talked about the 4 M's. So now I'm going to turn it a little bit, and I'm going to ask you, doctor, what matters to you
What
when it
matters
comes
to
to your
me,
whole life?
just finding joy every day and in my surroundings and my children and my family and my friends, getting out and exercising and enjoying nature that God gave us. Today I was already on the Acosta Trail. That's how I started my day. Fitting
Nice.
that in and really having that purpose of using knowledge that I've trained for to help our community just be stronger, age better, stay healthy, um, because I love being a part of Western North Carolina, and it's a beautiful place to live and such a friendly community to live in.
Mhm.
So I really just try to enjoy that every day.
I love that. And you are doing this now with, I remember not too long ago, maybe a year or so ago, you added a new member to the family. Do you take your puppy out on the trail with you?
Oh, he just learned how to leash walk. I'm so proud of
Yay,
him.
Bo!
Yes.
Congratulations, Bo.
Thank you. Well, he is the youngest of, his older sister, Celia, she's 15 now, so
Okay.
he is by far the most spoiled baby of the family.
Well, I love when you tell Bo stories and share moments like this because it also reminds us too that you're practicing what you preach when you talk to us, when you give us insight. And that's such a spirit of generosity to share what you've learned in a
Thank
way that
you.
brings joy to other people and helps them realize that they can experience what matters to them as at any stage in our lives, right?
That's so true, yes.
Absolutely. Well, before we go, is there anything else about what drives you as a doctor and as part of the AdventHealth team that I haven't asked you about?
Mm. I just feel like the culture here is so good. I love our service standards.
Mhm.
Love me, keep me safe, make it easy, own it. I might have said those out of order. Sorry,
But you
Victoria.
got them all. I was
But
like, "Wow, she's good." Faster than
You
me.
know, I learned those here. I learned those here at Advent Health, and, they really stick with me throughout my day. How am
Mhm.
I doing that in my life, for the people around me? The other thing I'll say is, we just don't realize sometimes the value of relationships, but having healthy relationships, being in contact with others, whether it's your family, your work team, your church, your community groups. That really, when it comes down to it, when people you ask them at the end of life what was most important or what you find fulfillment in, really it's relationships, and that's just as important as keeping a heart healthy diet or not smoking. Is keeping up those relationships and not being isolated or lonely. And so I just encourage all the listeners out there, to reach out to a friend today, to be part of a community at some level, to really get outside of yourself, to keep your health and your brain healthy.
Well, doctor, that's some good advice.
Thanks.
Thanks so much for being with us today.
Yeah.
It's always so much fun talking about age friendly and what we're doing to care for our older adults in our community, but also for each other. Thank you, Dr. Anna Hicks. And she is the one who heads up as the Administrative Director of Age Friendly Services for AdventHealth Hendersonville at AdventHealth Polk. Thank you for joining us today. We'll see you again on the next Live Better, Feel Better podcast here at AdventHealth.